And I'm live. So I am going to invite Dr. Seema on for our upcoming conversation about menopause and dry mouth. So I'm going to get Seema coming right here. And she should be joining us shortly. So if you are just hanging out this afternoon and you have some questions about dry mouth and being in perimenopause or menopause, you're in the right place. So I expect, here we go. And I see Donna waiting for us to go live. Hello, Donna. Bear with us as we figure out our technical. Okay, she's unable to join. So here we go. We'll just keep at this. Invite. There we go. So I warned Dr. Seema that I've only done 2 of these Instagram lives, and there you are. That's why I said I've only done 2 of these so far. So this will be number 3. Hello, Dr. Seema.
Hello, Dr. Jacqui. How are you?
Doing great. So I was just giving a little bit of a introduction to our topic today, which is around menopause and dry mouth. And this idea came along from a conversation you and I, one of the many conversations that we have when we get on the phone together. We can just talk for hours, but you genuinely had a question for me, which was around the idea of how to support a menopausal woman with dry mouth from 2 perspectives. One, as a dentist, because you see this a lot in your practice, and also just personally because you were asking, like, what would you as a naturopathic doctor be doing for me as a woman in menopause? So I thought maybe we would start off, if you want to just tell our viewers a little bit about who you are and what you do and why this is a passion for you, because I've never learned so much about the mouth since I've learned from you in the little bit of time that we've known each other. So yeah, just tell us a little bit about why you know so much about the menopause mouth.
Okay, well, hello everyone, and thank you for joining us. My name is Dr. Seema Agarwal. I am a dentist in Ontario. I met Dr. Jacqui last year at the Menopause conference, and we are sisters from another mother. I honestly, it's when we
Yes,
talk,
yes.
it's never a short conversation. I love talking to you, Jacqui. So thank you for having me on. I just wanted to say I've always been interested in the role of functional medicine in dentistry. I've always said that, it's much easier to not to prevent a fire than to perpetually be putting out fires as a dentist and dealing with those complications. And as a menopausal age woman myself, I began this passion project and journey of mine to unpack the menopause mouth. As you know, my Instagram is Your Mouth and More, and I've joined Dr. Jacqui in the past. And I basically uncover the root cause of things that are pertaining to the hormonal effects of menopause on the mouth and the long-term implications, because your mouth really is more important than we give credit to. And so Jacqui and I were speaking about the fact that I said, look, I'm in menopause. I know what to do. And I know that dry mouth is absolutely devastating to a mouth. The saliva is so critical as a protective buffer in so many ways beyond just lubrication, that when a person has dry mouth, and I've seen the consequences of the implications on decay, on the implications it was your teeth abrade with each other and loss of structure, that dry mouth is the one thing that really no dentist has any tools or magic wands to compete with. There are saliva substitutes and things like that, but it really comes down to managing dry mouth. Now, one of the reasons saliva decreases in menopause is because of estrogen. We all know estrogen goes down and all the fun things that happen with it. But there also is a role of cortisol and stress management. Because, when you get really stressed, your body's not thinking of, oh, do I need saliva to lubricate my teeth? It's about getting you out of that moment. But also in menopause, our stress management changes. So even if you're just annoyed at the person in front of driving in front of you, somehow your mouth dries up. And as
Mhm.
a dentist, we see the implications of that. And
Mhm.
then the last thing is, just as we were discussing, is dehydration, right?
Mhm.
Everything is just dry. And so how do we balance that so that you don't have the detrimental consequences of saliva? So she and I were having this discussion, and we were just having this spontaneous talk. And we said, we should share this information because
Yeah.
we're both at that age, and
Mhm.
we both are interested in this. And so
Mhm.
it's about relating to all the women out there and saying, you're not the only one. 70% of women have some form of dry mouth gradient, and
Mhm.
most people just accept it.
As they do accept a lot of other things that come
Right.
along with hormonal changes, that everything just kind of gets blamed on menopause. And so, to your point around the drop in estrogen, you're absolutely right. Like, of course, every part of our body, every tissue in our body pretty much has estrogen receptors. So as soon as that estrogen drops, then what I like to, what I've noticed about menopause is that it's an amplification of some underlying imbalances that have been kind of lying in the weeds for women for many years. Because if estrogen was solely the problem, like if a drop in estrogen was the primary cause of all of our symptoms, then we'd all experience everything the
Right.
same. And of
Yep.
course, we don't. So that means that coming into perimenopause and menopause, some are going to be more predisposed to dry mouth, as an example, because that's what we're here to talk about. But we could say the same thing about a lot of the other things that you and I have talked about. But you might be more vulnerable given how you were coming into perimenopause and
True.
menopause. So that's what you and I are here to talk about. So from your perspective and my perspective, how do we support the whole body approach to the health of the mouth? So I thought it was pretty interesting. First of all, like when we think about saliva, we don't really think about like what is saliva. So why don't you tell us what actually is saliva, first of all?
Saliva has become this golden elixir that I'm obsessed with.
Mhm.
And it's one of those things that when you have it, you don't appreciate it, as so many times in life. And when you lose it or when there's less of it, you're just like, oh my goodness, like you really feel it. So saliva is more than just water. It is primarily an aqueous structure, but it's a combination of electrolytes. It has a mucinous component, which is that thickness to it. It has a lot of enzymes. Your digestion begins in the mouth. So if you don't have adequate saliva, you won't have be able to break down certain carbohydrates. It has antibodies. It has minerals. If you can imagine, your tooth, there's actually a lot of YouTube videos that show like a tooth and Coke. And if you ever see it, you'll see what happens, hang on, when a tooth actually, is immersed in acid.
Mm.
What your saliva is composed of is a reflection of what you're absorbing, and what's actually in your blood can either make cavities while you sleep or fix cavities while you sleep. It
Um,
can it can help you digest things. It gives you so many functions. The lubrication aspect is actually critical just for speech. And one of the reasons I started my passion project is because, especially when you hit menopause, you have a lot to say. Like you've been through enough that you're like, so I'm like, if you want to say what you want to say, you need your teeth.
and you
Right?
need your saliva.
You need your saliva. Like it's just, even if you're just annoyed at your children or you're annoyed at your husband or something, right?
Yes,
Like you
you
want to
want
be
to
able to
say.
express those thoughts
Yeah,
freely,
yeah.
right?
Oh my
Without
gosh.
having to think of like, oh, I want a glass of water before I yell at
Yeah,
you,
yeah,
right?
exactly. Oh
So,
my gosh.
and my
Yes.
husband said that. He's like, do you want your water before you yell at me? I'm like, I do.
What a guy. He just knows. He just
He
knows.
knows.
No,
He
that's
knows.
awesome. Yeah, it's so powerful. I mean, honestly, like when we talk about like the perfection of our bodies, and when you talk about it as this elixir, I always refer to the saliva as like the first part of your immune system. So when we're talking about the gut
Yep.
and the connection between the fact that 70% of your immune system is in your gut, but that immune system starts in your mouth, right? So there's so much power in that saliva. And when you
Well,
talk about it's what you absorb, now you're speaking my language, because
right.
I talk about digestion, absorption, and elimination all the time. So it's really, I mean, it just comes back to roost again on, it doesn't matter what part of the body we're talking about. If you're if you don't have the building blocks, then that's going to affect all sorts of tissues, including what's.
Absolutely. Honestly, and one thing, I mean, a couple of things we notice is that as you get older, your saliva becomes more acidic. And
Mm,
so, I always say, especially at the gum line, like let's suppose you've gone to sleep and you brushed your teeth, but your saliva is more acidic, right? The composition of that saliva, you can actually make cavities at the base of your roots because that's where it sits, just by it being more acidic. And you're thinking, well, okay, I'm doing all these things to keep myself part of my self-care. I'm brushing my teeth. I'm doing, I'm trying to be good and everything. And the sheer fact of the composition of it. So
mm.
being cognizant of all of those things, your teeth are actually, I didn't appreciate this in dental school. Your teeth are actually this beautiful structure. As you can tell, I really feel strongly about the fact that I
Yes,
want
you do.
women to keep their teeth.
Yes, yes. Well, and so it's so interesting since I met you, like I think about teeth so differently. And I notice in the women that have come under my care in their like so they're postmenopausal already when they come under my care. And it's shocking to me the effect that their oral health has had on them because they maybe didn't have this information early on in life or didn't have access to the care or whatever it was. But yeah, it's significant now in their 60s and 70s, the impact that their oral health is having on their whole body experience. So,
So there was an article I read, and I can't quote it directly because it was some time ago I read it. And it basically, it was in a cardiac journal. It was a medical journal, and it basically said that having tooth loss in their 50s had a ramification 10 to 15 years later of an increased risk of heart disease. And the reason is because every tooth lost is associated with some shift in the microbiome and
oh,
that microbiome alteration. So I'm going to say one thing to you that's going to make
yes.
everybody brush their teeth tonight.
Hmm.
So what's the average heart rate? Let's say your heart rate's 60.
Okay.
Okay.
Yep.
So that's 60 times per minute your heart will beat. That means your blood circulates. Okay.
Yes. Yes.
That is 60 times your blood will come to your gingiva, your gums, per minute. If you
Amazing.
sleep 6 hours a night, that's 360 times that blood is coming up to your gingiva.
Yeah.
If you have plaque sitting under your gums, that's 360 opportunities per night for bacteria from there to enter your blood. And that bacteria has a huge implication on inflammation in the body.
Mhm.
We find periodontal pathogens associated with Alzheimer's and neurodegenerative diseases. It
Mhm.
increases risk of heart and stroke disease. So I remember I was telling somebody that, and she's like, I just want to go brush and floss.
I know. I think I need to go right now. Okay. I'll be back in 3 minutes, Seema.
There you go.
Yeah, no, that is staggering. Oh my gosh. And again, like as a medical professional, like I know these things that I know what the heart rate means, but when you put it into that context that that blood is circulating past through your mouth that many times, that's staggering. So okay, so why don't we talk about what are some of the things that we can do about this? So the first question I have is when you're talking about pH. So you brush your teeth, you think you've done your due diligence for the night. Is that a good time to maybe check the pH of your saliva to
Okay.
know what is your pH going to bed?
Okay, so you can. Generally, your mouth is very influenced by what you put in it. So in general, we like to check saliva pH, which we will do a separate Instagram live along with like demos and everything. Generally, you want to check it either first thing in the morning, and I did do a post on that, and I show it. And you basically like you can just take a spoon and take some
Yeah,
pH paper and spit on it. It's nothing complicated.
yeah,
You can buy probably a lifetime supply of pH paper for about $7. So because you
yeah.
just need a little strip, you don't need the whole thing.
Yes,
Um, so generally, we recommend we want to know what your saliva pH is, not
yes.
the pH of what you put in it. So if
Mhm.
you check it at night, right, you can certainly see what it is going in, but in approximately 30 to 45 minutes, your body is going to equilibrate to what your body is anyways.
Right.
So if you want to know what your saliva pH is, the best time to check it is either first thing in the morning before you brush, before you take any
Mhm.
medications or sip any water,
Yeah.
or when you've had a longer interval. I even say up to 1 hour with nothing in
Mhm.
your mouth and then check it then. So that's
Perfect.
basically like getting a baseline of understanding where your saliva pH is. And the pH is at acidity level.
Okay. So the ideal pH should be neutral.
Well, I mean, American Dental Association guidelines state that it can be anywhere from, I think, like 6.5 to 7.5 or in that
Right.
range.
Right.
Most dental associations will agree. You'll have some variation, even like week by week. But
Hmm.
the idea is that if your saliva is more acidic, you're going to be more susceptible to losing minerals as
Yes.
your teeth, from what your teeth are being bathed in. Plus,
Right.
you're also lacking in the minerals of your body self-repairing. It doesn't have
Right.
the building blocks then of putting those minerals back.
Exactly. So, and then as far as pH paper, do you just buy it at the pharmacy or something? Like you can
I
just
just
go
buy
and,
mine online. I buy it for the
okay.
clinic. I get like three
Yeah.
packs. I
Okay.
had it in my gym bag and I was talking to a trainer at the gym and he was showing me this electrolyte powder and I'm like, let's just check. And that's going to be a whole other topic too. I did a couple of posts where I actually show the pH of different electrolytes. And especially as
Amazing.
as you're fasting, people are fasting, your saliva levels go down because you're not
Hmm.
eating,
Right.
right? Your body's
Oh
conserving
my
energy.
gosh.
So
I just have this image of you running around the gym with your pH paper, just like,
I've kind of known. I've
like, oh
kind of known. But the whole
my
idea
gosh.
is that if you if you actually are when your saliva is even lower because you have a prolonged period of fasting or something, because your body's conserving energy at nighttime, the reason you don't drown is because your body's saliva levels go
Mhm.
down.
Right.
If at that time you now take in something acidic,
Hmm.
right? You've lost your protection and you've introduced an assault.
Wow.
So it's
That's,
like a double whammy,
it is. That's just
right?
huge. Yes. Yeah.
So, which is why I speak a lot about, and it doesn't have to be a high cost solution. If you check, most municipal water in Canada is
Hmm.
pH neutral.
Ah, interesting.
Okay,
So that's a good place to start, right?
it's
Is
a good
just
place to
check your
start. Just
tap
check your
water.
water
Yeah.
pH. Check your tap
Yeah.
water, right?
Yes.
Most of it is regulated to be approximately neutral. So something as simple as taking some water and swishing it through your mouth and
Hmm.
swallowing it because it's your water and your saliva, or spitting it out, either way
Yeah.
repeatedly will automatically reduce the acidity level if you've had
Hmm.
something acidic. And this is like a zero cost solution. This is like
Yeah.
something you
Yeah.
just have to build a
Totally.
habit, right?
Yes.
And if you're taking a water bottle around, well, a lot of bottled waters are acidic. Try if you have to pick one
Hmm.
up, pick up a mineral water. If you're taking water from home, just make sure it's not acidic.
Yeah. And like you say, zero cost to this. So,
Zero
so
cost.
that's brilliant. Yes.
Yeah.
Yes. So let's talk a little bit about, so we talked about strategies. So if dry mouth is something that you're dealing with right now, what would be some of the medical strategies that, or something that you would be dealing with somebody in your chair? And then I can talk a little bit about it from my perspective, what
Okay.
we might do from as a whole body approach to somebody who has the dryness.
Okay. So, I mean, what is dry mouth? Dry mouth, first of all, is a response by the body in response to hormonal changes, in response to dehydration, in response to a stress response, by which your body reduces the amount of saliva in your mouth. So, the dry mouth term kind of expresses it all. Most women begin experiencing this when they enter the late perimenopausal stage or the menopausal stages.
Mhm.
Okay.
Yes.
Um, so we understand the why is the hormonal changes. Cortisol is actually a component in your saliva response because if you can activate your parasympathetic nervous system, you'll actually find that you just feel calmer, and
Right.
that intense alert assault feeling in your mouth may not be there, and you have to have a calmer feeling, and then you find your mouth may not be as dry.
Right. So for people who don't understand parasympathetic, they might not
Right.
be familiar with that term. So we're talking about the opposite of fight or flight. The
Yeah.
parasympathetic is the rest and digest. So when you talked about, let's say you were stressed out in traffic or something, all of a sudden your heart rate goes up, you're in that fight or
Yeah.
flight, you might notice that dry mouth. So even just a simple strategy of moving yourself, maybe some deep breathing, a couple of
Yeah.
deep breaths, that sort of thing would help move you into the rest and digest mode fairly immediately.
Fairly immediately. Again, zero cost. It's something that's in your control,
You're
right?
breathing. Yeah.
Your breath. You're literally
Yes.
just your breath.
Yes.
Um, so, and I just had some notes here. So, what, you have to think about what happens. What happens if you have dry mouth? What are the long term? Now, there are many gradients, right? You can have
Yes.
a little bit of dry mouth. You can have like cactus level, right?
Yes.
So, what happens is first of all, you don't have the minerals. Aside from digestion, I'll leave that to you. But from a dental point of view, is you don't have the protective buffer. You don't have the lubrication. You don't have that flushing out of things, right? Things tend to sit there. There isn't water naturally moving it out. Think of saliva as a really, really low grade water flosser,
Mm.
right? If you have a
Yes.
lot of it, it just
Yeah.
kind of moves things around. Things don't get stuck in nooks and crannies to
Yeah.
cause problems.
Yeah.
Most cavities, when you go to the dentist, if you're brushing your teeth, most cavities tend to happen in between the teeth,
Mm-hmm.
right? And so those are areas that if you don't have an abundance of saliva flow, if you're not cleaning those areas, then stuff is going to stay there,
Yeah.
right?
Absolutely.
So what happens, you have a much higher susceptibility to decay and to
Mm-hmm.
cavities. And it's very frustrating because as a dentist, I love treating patients, but we understand when patients come to the dentist for a filling, it's not their happy place always.
Fair enough.
Right. So, if
Yeah.
you can avoid
Even
it,
as lovely as you are, Dr. Seema, they may not want to be in your chair.
right. Because it's just, it's,
Yeah.
it's one of those things when you have to think about
Yes.
the environment.
Yeah.
And then the other part of it is sometimes women, especially as we find that over the age of 50, a lot of women will come in needing a night guard.
Mm.
And I
Interesting.
always used to wonder, I was like, is this like a rite of passage? Like, what is happening?
Yeah.
We
Hmm.
now know that sleep bruxism, or grinding as we call it, is a form of mild sleep apnea. And that's another whole big topic. Well,
Yes. Yes.
but the thing is, if you are, you know what, let me get my models here. Okay, sorry. I wasn't planning this, but here. Okay, so here we go.
Mm.
I got my model
Love
here.
it. Oh,
Love it.
yes. An
Okay.
extra set of teeth. Okay.
So if you are grinding, okay, so if the upper jaw is stable and the lower jaw is grinding, it's actually, you can see you're trying to get air in. But there's a
Yes.
certain amount of abrasion. You can hear it. There's a certain amount of just contact.
Yes.
Okay. So now in a rough environment with whatever saliva there is acidic, the minerals wear off much faster because you're applying forces in an
Right.
acidic environment. So then you tend to actually, I don't know if I can compress this, you actually tend to like lose some what's called vertical dimension.
Mm-hmm.
That has tremendous consequences long term. If you can see in the back here, if you can imagine and just kind of compress it, that has tremendous consequences for how much space your tongue has,
Of course. Mm-hmm.
right? But now you've lost that. So I would say a few things. Number one is, aside from the dry mouth, if you need a night guard, if you are grinding your teeth, get a night guard. Protect that structure. Go
Yeah.
see your dentist, have a discussion with them, right? Do your due diligence into the possibilities of like mild sleep apnea and do that. But also understand that that is what's going to protect the structures while
Right.
you have dry mouth, and you're losing those minerals abrading away,
Makes
right?
sense. Makes
So then it comes down to, okay, so if 70% of women have some element of dry mouth, or that they have, they feel, or some gradient of it, then what can you do about it?
mm-hmm.
Okay, so I'm going to hand off to you in a moment, but I'm just going to say that two things that we know work very well are to continuously hydrate with pH neutral water. You don't have
Mm-hmm.
to buy fancy alkaline water. You can just check your tap water and drink tap water.
Yeah.
Okay, so that is a zero cost way to just keep things moving and hydrated. Number one.
So a question on that then. So let's say, because I think a lot of our viewers may not be drinking tap water, they might be drinking
Yeah,
RO water or some type of filtered water.
right.
And let's say they check the pH of their water and it's a bit acidic. So then what about the trace minerals or the different things that you can add back into your drinking water? Are you familiar with that as
I am
well?
familiar with it. I'm at a point right now in my own home where I don't have an answer for you directly. I'd have to research this and let you know.
Yeah.
I have RO water
Hmm.
and I have a fridge carbon filter, and the
Yes.
pH of those two waters are quite different.
Interesting.
Okay, so my
What
carbon
is
filter,
what's your RO?
My RO water
pH.
is, I mean, probably closer to a six now, right?
Mhm.
Something like that.
Right.
Maybe
Yeah.
somewhere between like the high five, six type of thing.
Yes.
My fridge filter water is somewhere between a 6.5 and a seven.
Yeah.
Right? I mean, it's because you see, I don't have like an
Yeah. It's
accurate
just a
digital,
carbon. It's
right?
a
I'm looking
carbon
at my,
filter, right? So
yeah.
yeah. Yeah.
It's like but I'm looking at my little, I don't have my pH paper here because my purse is over there, but
Yeah.
um, it's just like a color scale. So you're
Yeah.
kind of there saying, okay, well, obviously it is more
Exactly.
alkaline. And
Yeah.
then my tap water is definitely like close in where I live, close to a solid seven.
Yes.
So given that, right, after I eat, because your mouth is quite acidic at that moment in time, I'm not going to rinse with my RO water,
Right.
right? I'm going to go and rinse with my tap water. I'm just going to go
Yeah.
and rinse my mouth out.
Yeah.
And because I know that that is going to move things around,
Hmm.
right? It's going to irrigate things around and it's going to neutralize the acid. And it's a simple thing until I can go and then go and clean my teeth and everything, right?
Yeah.
So again, it's a simple thing. So using hydration and rinsing of water, right, is a
Yes.
very simple first step. If you need to, please go talk to your dentist about something called biotin. And that's not, I'm not promoting the product or
Right.
anything, but there are saliva substitutes that are designed with no flavor or anything to them, and their purpose is to lubricate the mouth.
Can you get
Right?
that over the counter or is that a prescription?
Over here, you can get it over the counter.
Okay.
In Ontario. So I don't know specific, but we do, like, the company will give us pads or whatever, and we can certainly tell patients about it. But it is definitely something that, or you can speak to your pharmacist
Mm-hmm.
about a neutral, unflavored biotin, because it's really imperative that even if you find something and it's like, oh, it's like strawberry flavored or something, right? It's
Yeah.
really imperative that what you're coating your teeth in is either completely neutral,
Mm-hmm.
okay, or will add some benefit. But the
Yes.
minute you add a flavor component to this component, there's other things in it.
Exactly. That's
And I don't
exactly
want
it.
you trying to do right by you, saying, I'm having these symptoms, it's very
Yeah.
uncomfortable. And then you put something on there, and then bit by bit by bit, it's losing minerals because I
Yeah.
can't speak to the contents of those items.
Exactly.
Right?
Yes. Mm-hmm.
So those are the things that, we recommend as dentists. You and I were discussing, and one thing that a food that I use that I find helps me a lot is aloe vera gel.
Mm-hmm.
Right? It's just a food. Like
Yeah.
I've actually gotten quite good at buying from the grocery store the aloe
Mm-hmm.
vera leaf. I can cut it out in something and I'll just, as a food. I don't use any supplements for it because
Mm-hmm.
I have not found any credible science that I have found that says anything that will directly increase salivary flow. Is
Mm-hmm.
there something out there? I'm not aware of it.
Mm-hmm. Well, so this brings us to the treating of the whole person approach, which is to look at the mouth as a microcosm and as a representation of what might be going on in the rest of the body. And so that's where I do a whole body approach, which is if there's dryness in the mouth, there is a possibility that there's dryness in other aspects of the person's body. So
Yeah,
whether that's dry skin, whether you're noticing it in your like you might notice hair, skin, and nails. Like so,
yeah,
the one might be reporting that her hair is really dry. Obviously, vaginal dryness may be a factor for a woman in perimenopause, menopause. So anything that has an epithelium to it, right? So there's
mhm,
a certain, and even though the tissues are slightly, the histology of the tissue is different at different parts of the body. Overall, we know that that what hydrates the tissue in one part of the body may likely be
right.
hydrating it in other parts of the body as
Yeah,
well. So that whole body approach would come into play by doing like a full intake for the person, and then looking at what is happening at the level of the cell membrane. So you and I have talked a lot about this in terms of understanding whether or not the person is hydrated. So, like you say, with the water, but then the other thing that holds water in the cell is the outer cell membrane, which
right.
is two layers. So we've got the water loving part of the cell membrane, and then the fat loving part of the cell membrane. And that's where we talk about the structure of the membrane and we look at the composition of the membrane. And that's where understanding the omega 3 status, understanding the omega-3 index, looking at the 6:3 ratio. And interestingly enough, and again, you and I have talked about this, if a lot of my patients we've had this conversation with, that if you're not absorbing, then you can, it's like throwing
Yeah.
chalk at a chalkboard. A little bit of hydration is going to stick, but a lot of it isn't if that moisture doesn't cross the cell membrane. So that's definitely, because I have seen when that ratio corrects, then all of a sudden the woman's hair feels less dry and it
Yeah.
feels healthier, and she'll report that her skin is feels healthier and looks more dewy, and then even improvements in vaginal dryness. So
Mhm.
that's that whole body approach, which is to say if it's happening one place, it's likely happening or potentially happening somewhere else. And so definitely in dry mouth we want to treat the symptoms. So whether, and of course there can be dry mouth that, like we talked about, was present at a low grade level prior to menopause, and especially if a woman has gone through any form of treatment for, let's say, cancer
Yeah. Oh, yeah.
historically, or she's on medications that she may not be aware has a side effect
Mhm.
of dry mouth, or maybe was on a medication and isn't anymore. But that's all part of the health tapestry leading into menopause. And so when we look at the history and we see that this may have been a concern previously, and then it stopped being a concern, and then menopause hits, it's like an amplification again. So this stuff just comes out of the weeds.
Yeah.
And so it's really, so it's such an individualized approach. Yet, as you and I can both attest to, there will be generalized strategies that will, like, that can be applicable to everybody. And then we would look at the comorbidities. So are there other symptoms that go with that dry mouth? So is there burning associated with the dryness, right?
Okay.
So that's
So
different. Yeah.
burning, I literally just spent the last week doing posts on burning mouth. And it affects women 5 to 7 times per male. It affects predominantly women over the age of 50.
Yeah.
Now, burning mouth is a neurological condition, and
Hmm.
it's damage to the small nerve fibers. And
Yes.
so it's discomfort is exacerbated, made you feel worse with it having dry mouth along with it. Like, can you imagine your mouth is dry and then you have this
And it's burning.
burning pain in your tongue? Like
Yeah,
that would feel horrible. Like, as you know, you
exactly.
wouldn't wish that on anyone. So I just want to distinguish between burning mouth
Mm,
and dry mouth. And
yes.
so dry mouth is more of that volume of saliva and then the
Yes.
consequences of that.
Yes.
Mhm.
And as we know, the body's complicated, and rarely do things exist in isolation. So
Completely true.
we might have some burning, we might have some there may be things going on with the tongue, there may be the saliva, and then there may be inflammation. So that's another
Yeah,
piece, right? So we might be seeing like an increased presentation of mouth sores, or just a general feeling of being inflamed, which again, rarely will your mouth be inflamed and you wouldn't have inflammation generalized. And of
100%.
course, and
Yeah.
like you said, you don't, as a dentist, you don't have the time or the bandwidth to do a whole body intake for somebody, nor is that part of your
It's not really
conversation.
part,
But
yeah, it's not
yeah,
really part of our profession
right.
in that way. I think conversations are happening, and I'm glad
Yes.
that we are people now, clinicians are more open and educated to having whole body discussions, and patients are open and more educated to have
Yes.
whole body discussions. So we definitely encourage that. And if someone comes in and has perpetual mouth sores that are rotating, we also know now that that may possibly be an early sign of Crohn's disease,
Yes.
because the ulcerations that are happening in the mouth are happening through the entire digestive cavity.
Exactly.
And
Exactly.
so, from that point of view, there is no actual separation. There are
Mhm.
zones, right?
Yes.
But we consider the entire gastric cavity to be from one orifice, lips, to the anus at the other end, and everything in between is part of the same system.
100%. So yeah, it's so exciting because I feel like it doesn't matter where you start on the body, whether you start in the gut or you start on the skin or you start in the mouth, or like it doesn't matter where you start. It all kind of filters down to the same foundational
Yeah,
um, best practices
yeah,
around how to optimize for, and in particular, because we're talking about the menopausal woman, I'm really mindful not to always just focus on the symptoms, but to help the woman understand that this is all part and parcel of the the way in which the body is reorganizing in many ways, reestablishing like a new foundation, a new set
yeah,
point, and that we can take this opportunity to, I guess, double down on what we've known, and a lot of what we don't know, because that's part of the narrative right now with menopause, is that women are realizing that what we're dealing with is not just aging, but
yeah,
it's an I always say it's an amplification of what we didn't address coming in to menopause. So
yeah,
whether that was not paying attention to our oral health as much as we could, or we just didn't have the knowledge or the access. For me, it's around that gut brain connection, not understanding that what was going on with your cycles monthly, every month you were
right,
dealing with these things.
yeah,
Now all of a sudden, maybe you don't have a cycle or it's gone wonky,
yeah.
and it's like you don't just wake up one day with what's going on in your mouth, and you don't just wake up one day with all the other hormone imbalances. So I think that, so if you had to give, like, let's say, three tips as like sort of parting recommendations, if we could all, if you and I could give three tips each, what would they be?
Okay. Okay,
Yeah.
so first tip would be first of all, it's understanding that you are not alone. Okay,
Mhm.
so I always tell every woman who's going through this that on some level, as you said, your menopausal symptoms are being shared by a vast population, and therefore there are solutions and discussions. So
Yes.
don't feel like you have to go through this alone. Definitely have that conversation with your dentist, with your hygienist, your dental assistant, with the staff, and they will have symptom solutions in place as well that they can make recommendations to you.
Mhm.
So that would be my first one. So I'm going to take four. The
Yeah.
second one will be um, hydration, as we discussed, because
Mhm.
water and that washing of water perpetually in your mouth with a neutral water is actually one of the kindest things you can do to your mouth. And it just keeps things very, it keeps things clean and fresh in that regard, like in a simplified term. Um, really take your oral hygiene very seriously.
Mhm.
Okay. If you, I mean, I don't know if you still have snow in Saskatchewan. We don't have it anymore, but I would say, like, if you took a driveway, so I always tell my patients, and you have a difference option between a snowblower and a hand shovel, and you've got 10 minutes, let's say. Which one are you going to get more results out of? So a really good quality electric toothbrush, and I have no brand association or anything. I would go speak to your dentist about it. Um, will get that job done because truthfully, most people need more than 2 minutes to take care of their teeth. We're happy if people spend two,
Mhm.
but you want to go in there and don't think of plaque removal, brushing your teeth. I want you to think of it as wound care. I want you to go
Ooh, I
in
like
there.
that.
Yeah,
Yeah.
I just want to say,
Mhm.
go in there and wound care. Go in there like you would, to get your mouth to the point where it's pristine. Do not scrub to the point you'll actually cause damage, but learn the technique. Go with your phone to your dental visits. Speak to the hygienist. Videotape them. They will be happy to show you. If you show interest, they'll be ecstatic. Right? And that's it.
Yeah.
Teach me, how do I get into those nooks and crannies? Where are my weak spots? Where am I holding food the most? Where am I most susceptible? How do I get my mouth so that when I go to sleep and I have lower saliva levels because my body's in a restful state, when I have hormonal changes that are affecting the composition of my saliva, and
Mhm.
now I'm all sitting in this, it is, and otherwise, your teeth are vulnerable at that time. How can I go to sleep with a really clean mouth? Do not scrub, do not take a hard toothbrush, do not do any
Right.
of that. Learn the
Mhm.
techniques so that your mouth is clean, so that when you actually go to sleep, there's less likelihood of something progressing.
Mhm.
Okay. And then come into considering that saliva is a secretion of the body, right? It's an essential thing, and that your hormones and your cellular function and your stress levels impact it.
Right.
So be
Hmm.
aware of saying, when I am doing this, I find myself tightening up, right? And I find my mouth gets very dry. Like for me, it's when I get really tired. Like when I'm tired, that's it. My mouth is dry. I can drink all the water, I can drink all
Yeah.
the mineral water in the world. And I did
Mhm.
a post on this. And what I need to do is I need to go sit down. I need to spend 10 minutes. I do my box breathing. I just relax. It just gives me a certain amount of time. And I notice that my everything just feels calmer. So these are
Mhm.
not, I really want women to understand to keep your teeth, you don't need high cost, fancy solutions. You need to make sure you don't have open cavities because that's a source of bacteria. You need
Yes.
to make sure that you take care of your mouth. Make sure that you're rinsing your mouth and hydrating. And otherwise, what you were born with is actually fantastic. And we
Hmm.
just want you to keep it.
I agree. I 100% agree with that. So I know we're supposed to be just giving like our wind up tips, but I have all these questions forming in my mind, which is around the stimulation of saliva, let's say after you eat, because you talk about rinsing your mouth, but how do you feel about gum, like
Okay.
sugar-free
So
gum or
I have a
xylitol gum?
I have a
Yeah.
love-hate relationship with gum. I do
Okay.
use it. Okay. I do
Hmm.
use a sugar-free gum. I have a couple of brands that I go to. And what it does is, so stimulated saliva is
Yes.
actually more alkaline and very
Okay.
good for your teeth. So if you
Okay.
were to use a sugar-free gum afterwards,
Mhm. Yeah.
it is actually, they found quite a bit of benefit.
Okay.
And a lot of
Awesome.
people find it's a simple thing. Like you keep it in your
Yeah.
purse and you go.
Yes.
Um, I generally don't like, I never want to ask someone to become dependent on a product,
Right.
right? I want to give you zero cost solutions to otherwise manage it. But the other thing is that every time you introduce something in, like, xylitol has had very, very concrete data on
Hmm.
decay reduction,
Yes.
right? But it also has a small antibacterial component.
Hmm.
And so
Yes.
whether or not you need that is something you have to have that discussion with your dentist and say, is this something that would be beneficial to me?
Right. But
Right?
I can't see a downside to having a slightly
No,
antimicrobial effect with the xylitol. So, like,
no,
I think
yeah.
that's, yeah.
So from
No,
that point of view, yeah, and
yeah.
100%, what do I keep in my purse, right? And I did a post on that too. But I literally keep interdental cleaners.
Yes.
And if I'm at, I'll step into like, my friend's house, the restroom or something, and I'm like, I don't want to leave the plaque there. It
Yeah.
doesn't need to be a big production. I'm not taking
Right.
floss out in my friend's kitchen, but like it's my personal choice. If I have
Yeah.
something there, I don't
Yes.
want to leave it there.
Yeah. That's,
And ever since, and I always say I'm addressing all of this I'm a dentist, but I'm also a woman in menopause,
hmm.
right? So I noticed I was getting a little bit more food caught than before, and I was like, huh, and that's a change in your bone level a little bit,
Yeah, I know.
right?
That's another whole topic we
That's
could
a
get
whole
into
other
around
topic.
bone density and like, yeah, it's just so fascinating. And that's what I love these
Yeah,
discussions. Remember I said this was going to be like a 3 to 5 minute
I know
live
it never
and
is with
we're,
us.
yeah, no, yeah, I know.
It
So
never
this,
is.
this is great. Okay. Do we have all your tips then?
Pretty much, those are the core ones. I
Yes.
definitely,
Yeah.
I just I want women to know that they should have this discussion with their dentist or the registered dental hygienist, that
Yes.
they are not alone. This is a very common menopausal symptom,
Yeah.
that there are ways to manage it. There are simple zero cost solutions. And now you have an understanding of what happens if you don't manage your dry mouth, that the consequences can be quite
Yes.
devastating sometimes.
Yeah, it's an eye opener for sure. So I would say that my tips are around understanding that the mouth is can be representative of what is going on in the rest of the body. So rarely does a person, often when a person comes to me, they come to me with a symptom. So it might be that they might have migraines, they might have IBS symptoms, they might have skin issues, they might have hormonal issues, they might have issues with their menstrual cycle. It doesn't matter what the symptom or collection of symptoms are that they might present to me with. It's always in the context of what is going on in the rest of their body, and what is your history. So I always talk about the tapestry of your health. So I would say my top 3 tips are: make sure that you're addressing the health of the mouth in the context of your whole body health as a woman
Yeah.
in menopause. So, because addressing one area can and often will help the rest of the symptoms. And I've always used a root cause approach, as you know,
Yeah.
because 70% of your immune system is in the gut. And we have so much of what we do for ourselves, it all involves the gut, unless we're bypassing the gut and injecting it into you through a vein. So if we're not injecting it to you in a vein, then it's hitting your gut. So it's starting in your mouth, but it's landing in your gut. So and a lot of activity is happening in the gut. So you're digesting, absorbing, and eliminating. So that's where I get the biggest bang for my buck, which is we work in the gut. So I always say gut is a garden. And so we weed and fertilize and work on the compost, which is the food that you're consuming. So that whole body approach will definitely benefit whatever's going on in your mouth, no matter what. And that's, you and I have had so many conversations already, and we'll have plenty more. But I would say that noticing like the symptoms that might accompany the dry mouth, like when you talk about the burning mouth, like that can be an indication of a certain B vitamin deficiency, right? So
Yeah.
those are the
Yeah.
sorts of things that
Yep.
I can look at and make recommendations around, because there's a certain, like B12 is
Yep.
associated with the health of your nervous system. So those are the sorts of things that I bring to the table. And then also, if you would ask me this question 2 years ago, I wouldn't have answered it this way. But because I know so much more about absorption and about cellular health now, it's
Yeah.
it's an absolute, like it's almost not an option to not know what those ratios are for yourself in terms of what's going on in your cells, that 6-3 ratio. And this is evidence based, Dr. Seema. Like, this is not something that just is a flash in the pan. Oh, now everybody's talking about
Mm.
omegas, just like everybody was talking about like seed oils and how they were like so unhealthy for us. But anything that you could potentially get sick from and or die from, you improve your chances of surviving anything by correcting that ratio. So when we're talking about menopause and we're talking about all the risk factors associated with having your estrogen drop, this is an independent risk factor that is independent of cholesterol, knowing what your blood pressure is, knowing what your blood sugar is. So it's that important of a marker. So if that marker has not been addressed, then we're also, it's kind of like the pink elephant in the room. We're not addressing it, but then we're
Yeah.
like trying to dance around it and find all these strategies. So, like I said, 2 years ago wouldn't have been the top 3 on my list,
Right.
but now it's in the top 3. It doesn't matter what we're talking about, whether it's talking about whether or not to do hormone replacement, whether it doesn't matter what that conversation is. When we're talking bone density, when we're talking brain health, when we're talking sleep, like, so if the cells look more like raisins than grapes, then
Yeah.
we've got a problem.
Yeah.
So
No, I,
the cells won't hold water.
yep.
So yeah.
It's true.
So that's the top 2. And then I think the third one is, I 100% agree with you that understanding that self-care right now is so important. And when you talk about the cortisol, like, of course, there's lots of talk about cortisol, and I think just understanding that, like, if there was ever a really good time to really stop and like practice self-care, this is
Yeah.
it. Because
This is it.
this is it. Because yeah, I mean, we've spent
Well,
the first 50 years of our life doing things one way,
yeah.
and it's possible that that way isn't going to serve us going forward. So it's really about understanding, thinking about what is going on in my body. And then, because like our health autonomy, it comes back to us. And so although there's lots of great advice and so much information out there now,
Yeah.
But how do we take that and apply that to ourselves specifically? Because how I respond in traffic is going to be different than how you respond in
Yep.
traffic, for example, right? So if I know that that's a trigger for me, then my saliva is going
Yeah.
to benefit
I'm
from me
telling you.
stopping the stress response. Yeah.
Yeah,
Yeah.
I mean, I think a certain freedom and wisdom comes with
Yes.
age, and you have a different perspective on things. Like I'm just speaking personally as a woman, like you have a different perspective on things, and so you sort of think about things. It's like, I have a certain some thoughts, and I want to share those thoughts. And so I always say,
Yes.
like, you got to keep you smiling, got to keep you talking, like, whatever it
Yeah.
is, you need your teeth to do that.
I love that. Well, on this note, let us part ways. And so you obviously have some really great and interesting posts. So if whoever's following us or listening to us, if you don't already know Dr. Seema and have checked out her posts, please do.
Thank
And
you.
I've been talking root cause approach to menopause for years, and
Yes, you
I
have.
have a book that women can read, or they can if join me on YouTube, because that's a place where you can learn a little bit more about what I do and who I am. And you can always reach out to either one of us on Instagram.
Absolutely. I'm
Yeah,
happy to hear from anyone. And honestly, I'm just glad menopause is getting the attention that it is now. When I think of all the women before us and what they went through and everything, and now at least it's definitely a topic that's being discussed.
it absolutely is. And we're so lucky to have somebody like you, because I don't think all dentists are going to be as passionate about the menopause mouth as you. So I just really want to acknowledge
Thank you.
and express my gratitude to you for your professional approach and for just being a great friend.
Oh, thank you. And I honestly, I'm always excited to talk to you every time, phone or video. I never know where we're going to go with this, but we almost said to the audience, we almost have to say, okay, I think we have to go do other things now because we could
Yeah.
just go
All
talking
right.
and talking.
Let's move on. Okay. Yeah.
Yeah,
So
yeah.
maybe a couple of weeks from now we'll do this again.
You know what? April is Oral Health Month, so
Ah,
I would
okay.
I would love to, and I'd love that opportunity. We can pick a topic, and I can get my pH paper, and we can do demos, and we can do all sorts of crazy things, with
I
pH paper.
love it. I love it. Okay. That's what we'll do.
Sounds
Okay.
good.
For now, have a great weekend, everybody. And thank you, Dr. Seema.
Thank you. Take care. Oh,
Okay.
I think you got to push it down. I don't even know how. I don't know how to get out of this.
How do we get out of this?
I
Okay.
think. Oh, hang on. Let me push this.
Okay. Yeah.
Hang on.
Oh, okay.